When we think about health, we often think about nutrition, exercise, or healthcare. But at Truth in Health, we believe healthy communities are built by people who care for one another. And that's why we're shining a spotlight on Nana's Closet, OKC, a nonprofit providing clothing, beds, school supplies, diapers, and hope to children and grandparents facing unexpected challenges. Today, I'm sitting down with founder Leela to hear her story, learn how Nana's Closet is making a difference, and discover how each of us can help. Let's get started. Today, we are joined with Leela Baker from Nana's Closet, and I'm very excited to introduce her to everybody, let you know what her needs are. So we have a lot of nonprofits around our metro area, and they do good work. And one in particular that stands out to me is Nana's Closet. So if you've been part of Mix and Mingle or any of those events, you've probably seen her around, making a tremendous difference in Oklahoma for children and grandparents. And that's what makes her unique. Many people don't realize that some grandparents receive a phone call in the middle of the night and become full-time parents by morning. You know, my grandma actually raised me and a lot of my cousins. So
Really?
If we had known you, 30 years, 40 years ago, that would have been wonderful. But Nana's Closet steps in during those moments of crisis with clothing, beds, diapers, school supplies, and hope. Today, we're joined with Leela, founder of Nana's Closet, and her husband, but he couldn't be here today, but his name is Lamont. And so we want to make sure he feels part of this conversation too, because he's a big part of what you do.
Huge part of what I do.
Nice. And so I'd like to just start out, tell us about Nana's Closet.
Well, Nana's Closet steps in when children find themselves in a kinship type care.
Mm-hmm.
So whether it's their grandparents or their aunt, uncle, a sibling even, can take in their sibling or niece, nephew. And so what we do is we come alongside them and we help bridge that gap, because usually what they receive from the child is just what they have on.
Mm-hmm.
No bed, nothing, no toys.
Wow,
and so
tough.
We bring in the beds if they need them. We bring in toys because that's a big thing.
Mm-hmm.
And 7 outfits. They get to shop 3 times a year. And we also have a Christmas program. And that's what we are working on right now. Our campaign is for our Christmas program. These kids already feel like nobody cares about me. Nobody loves me. Why did my mom and dad leave? And kids are mean.
Yeah. They are.
And why is your mom not around? She must not love you.
Oh gosh.
And then they go to school with, hand-me-downs or torn clothes. And so what we want to do is we want to help build their self-esteem.
Mm-hmm.
Have a bed like their friends. Have toys like their friends. Have nice clothes when they go to school. A backpack full of school supplies. And a nice backpack, not just a hand-me-down that's, dirty or torn up. The kids are my heart, because they have to learn that they do not have to continue to follow the same cycle
mm-hmm.
as their family, because sometimes it is a cycle. Sometimes it's not. Like our family, it's not a cycle, I don't think. We want the kids to know that they can break out of that barrier and become a better person in society and be successful. And it takes a village to help with that. I mean, really we can't do it ourselves. We need people to come alongside us and make sure that this happens.
Yeah, you want to set these kids up for success. And that's what you're doing, is giving them, a nice little step forward just in their environment, just the way they're treated, all of that. It's huge. And children are a product of their environment. So I think that's great that you are really helping with that. And so what is the biggest misconception that people have around what you do? Because you're Nana's Closet, so they might just think, oh, they just take clothing.
Well, a lot of times the biggest misconception is they think that we only help nanas.
No, that's a huge one, because it's in the name.
Because it's in the name. We help the children that are being raised by their grandparents. And so I'm Nana with my grandkids. And so that's where the name was born, Nana's Closet. My husband made that.
Okay.
And he even did our logo.
He did such a good job. I love the logo.
Yes, he did that too. And so that's one of the biggest misconceptions, is that we don't serve children and that all we need are clothes.
Mm-hmm.
What we really need is monetary donations.
Got it.
I have to work and my husband has to work, and then I do this on the side. And so I literally work 6 days a week and usually about 12 hours a day. I work at my job 8 to 6,
mm-hmm.
and then I'm texting or calling families in the evening time and having them shop Fridays and Saturdays.
That's a lot to juggle.
It is.
Wow. I didn't realize you had your dog too.
Yes,
So-
unfortunately.
And you mentioned your granddaughter. Can you kind of share that story with us and let us know since she's kind of the catalyst for it all, right?
Oh yeah, she is the whole reason that we do
Yeah.
this. Well, besides God. God is the main reason that we do this. When I was younger and in church with our kids, our pastor used to always say, God will make your mess your ministry. And I never understood that until I was living the mess.
Mm-hmm.
Our daughter became an addict in her later teen years. She first overdosed at the age of 16.
Oh, wow.
She shouldn't be here.
Mm-hmm.
She should not be here, but by God's grace, she is here. She became pregnant. We sent her to rehab before we knew she was pregnant. She found out she was pregnant in rehab.
Oh, wow. So healing and finding out she's pregnant all at
All
once.
the same time. Yeah. And so she did really good at the beginning, but then there was a guy, the father of our granddaughter. I call him the sperm donor. He was still an addict. She started to go around him again and then fell right back into being an addict.
Yeah.
And so she lived on the streets. We tried to bring her home, but she was 18 at that point. There was no bringing her home.
Yeah.
Actually, she was 19. In 2017, we received the phone call that she was in labor. When we saw the baby, Evelyn, she was perfect. She was born on her due date. She was a healthy weight.
Good.
Everything that you would, so in my mind as a mom, I'm thinking she quit using for the baby. By morning, she called and said, don't come to the hospital because she was put in NICU and she's just not feeling well. And so they put her in there. I knew something was wrong.
Mm-hmm.
They don't just put you in NICU for a fever or things like that. We had already had her sign over custody while she lived on the streets.
Okay.
We just did it at the DMV, just a little stamp. And when I got to the hospital to let them know that I was the guardian, the DHS was there.
Okay.
And they said, this paper is worthless. You're not a guardian. You have to go to the courthouse to become a guardian. And so she basically said, either we take her or they will. I went straight to the courthouse to see how I could get custody. They said that my husband had to be there and he was out of town.
Oh my goodness.
So he flew in over the weekend. That was a Friday. Flew in over the weekend. On Monday, we ended up with guardianship. It took a full day for us to sit at the courthouse waiting to see the judge. And a lot of grandparents don't realize that you can get guardianship without an attorney.
Okay.
And so when they call us and say they don't have guardianship, I tell them how easy it was. Yes, it's not a walk in the park. You don't just walk in and there's guardianship.
Right.
You have to fill out all this paperwork while you wait for the judge to see you. And the judge usually sees you at the end of the day. And then at that point, you get emergency guardianship. And then you have another court date to come back in. Evelyn was addicted to heroin. She spent 17 days in NICU.
Wow.
And they told us that the medications that they helped her wean off of the drugs, she could never have again. So that makes me scared for her in the future. If she decided to try, would she become an addict? And if she did, how will we get her off?
Oh, that's a scary thought for you.
Yes.
Yeah. No, I see that.
Yes. Fast forward, we adopted her when she was 2. We had sent our daughter to many rehabs.
Mm-hmm.
And just before the adoption was final, our daughter was rearrested and we sent her to another rehab. And we had watched her literally wither away on the streets.
Oh, that's so sad.
You hear on TV or on the news that they found a body of a female. And the first thing you think of, well, tell me what color hair she is. What color is she? All these things are playing through your mind. Mm-hmm. Am I going to get that knock on the door? Is it my child? Is trauma.
Oh, yes.
Mentally, physically, nothing but trauma. So she was rearrested, which it sounds terrible to say, but that's a relief.
Well, she's off the streets and she's safe. And
she's safe where she's not using at that point. We sent her to another rehab. We sent her a one-way ticket to Florida to a rehab. And we said, we're not bringing you back home because we can't watch you die. If you're going to kill yourself, you have to do it where we can't watch because it's just too much.
Yeah. Oh, mama. Yeah. I bet that was tough.
It was
a hard thing to do. But
yes.
It's also a good thing that you did because you can't enable, right?
No, you can't enable. Even though as a mom, you really, really want to make sure that they're safe and you want to baby them and you want to take away. Yeah, you want to take away everything from all the bad things.
Yeah.
But So we had to send her. She left just before the adoption was final. The adoption was finalized. They both lost their rights to her. The only thing we did was change her last name.
Yeah.
Then January 1st of 2020, we received a phone call that she was pregnant and coming home. And at that point, she was living in New Jersey. I cried. I cried because I thought, here we go again. We're going to raise another child.
Mm-hmm.
And not that I wouldn't, but you don't want to start over
Right.
yet again.
You've already been through that journey and you thought you were kind of over the
We
hurdle.
were empty nesters that long.
Yeah.
We went on one vacation and we haven't been on another one since. Our daughter cleaned herself up.
Okay.
She knew that if she stayed in continued addiction, that we would take this child too.
Yeah.
And she didn't want to lose this one.
Okay.
And so she has been clean for 7 years.
That's amazing.
Yes.
How's the relationship with her?
Really good.
That's incredible.
It is incredible. You know, you pray and pray and pray. And I mean, there were most mornings that I would sit. I worked at Dean McGee at the time, and my doctor didn't start until later, but I would get there at 8. And I would sit in a parking lot and cry and listen to Christian music. And it was like God was just talking to me.
Yeah.
And I would pray and I would text my boss, when I can clean myself up, I will be up to my floor and get my clinic started. And she was so understanding. And she said, okay, we'll see you when you get up here.
Yeah.
And I would come in red-faced and, you know, trying to collect myself, and then the rest of the day you're smiling and
yeah,
but inside you're dying. It's been such a blessing because he took that mess and made Nana's Closet.
Yeah.
To where we get to walk alongside other grandparents that are going through the same thing, and they feel alone, ashamed, because what did I do?
Right. They take that they internalize that guilt of, why did this fail for my child? And now I'm taking care of their child. I can see that.
We get to come alongside and say, you're not alone.
Yeah.
You feel alone. You're not on that island that you feel like you're on. Unfortunately, Oklahoma is in the top 10 consistently with grandparents raising grandkids. And that's not including all the other kinship that are going on with foster care or just through guardianship also. At first, we just concentrated on babies because that's what we received, was a baby. Grandparents feel alone on the island, and they get to see other families that are coming in and see that it's not just them.
Oh, do you have like a support group for all of them?
We do not. Sunbeam Family Services has a support group, but the only problem with that is that you have to be 55 and older.
I see. And some of them
was
are
40
younger than that. Yeah.
I was 42 when we received Evelyn.
Wow, you were young.
And so there was no hope. There was nobody for us.
Yeah.
And then we found out that Sunbeam didn't provide clothing. They didn't provide beds. It was just mainly mental support is what they do. And I talked to the director at the time, Talina Ford. She said, oh my gosh, we need somebody like you. This is something that needs to be done. And I was like, when I was getting ready to start Nana's Closet, I was like, wrong number.
Isn't that funny how we do that?
Because what I was looking for was somebody that I could volunteer with.
Gotcha.
Okay. I worked in ophthalmology for 20 years. I had no idea how to do any of this. How to start
a nonprofit,
how to start receiving donations, how do you do that?
I know. Yeah, I hear you.
And there was lots of Googling how to, and I'm like, okay, let's just see how this works. And then I found out I needed a board.
Yeah.
And then I was like, hey, Lamont's
calling
cooking.
All your friends.
Yes, my family. I'm like, hey, Lamont's cooking dinner. We're having wings. And that's one of his go-tos.
Yeah.
And they were like, we're coming.
Nice.
And I'm like, well, I have you here for a reason. And so thankfully everybody joined in helping us continue this program. It's been a blessing and a curse.
Right.
A blessing because we get to see the kids so happy. We get to see the grandparents' relief because, they're like, how am I going to do this?
Yeah.
And this is our busiest time of year. And we're booked out to August 7th.
Okay.
Families.
Everybody's getting ready for back to school, and then just everybody kind of comes to you around this time of year. Does this happen every year?
Every year around this time because school's getting ready to start.
Okay.
Some other nonprofits have closed their doors. A big one is
The Christmas place that you
Christmas Connection.
Christmas Connection.
Closed their doors, and they serve clothing as well.
Okay.
But from what I understand, in Cleveland County, like 89th Street South, they serve 500,000 families.
Wow.
And so we know
They're going to be looking for somewhere. And so that kind of segues into, what is your greatest need right now?
our greatest need right now is monetary donations.
Okay.
One, it will help me when it's time to go buy socks or underwear,
Yeah.
or if I don't have the right size shoes, I go buy them.
Yeah. So you're out of pocket for a lot of these needs.
Yes,
Yeah.
because you never want a child to come in there
Yeah.
and there's nothing there for them.
Right.
And so they're there to help. The best thing to do is to go buy those. And I don't go spend $50. I spend $20 on a pair of shoes. I go to Ross.
Yeah.
I look for the bargains, but I want them to be nice as well.
Yeah.
Something that they would
like you
actually
said,
wear.
kids are mean, and so you want them to, look like the other kids and dress like the other kids.
Exactly.
Yeah, that's hard for kids. I remember that going through school because I didn't grow up with much. Like I said, my grandma took care of me too.
Yeah, and it's hard.
Yeah,
it's so hard.
I mean, we would find stuff in the lost and found at school sometimes to wear. So
Oh, see, that's
yeah.
that just breaks my heart for you because I don't want that. And that brings me to what we do for Christmas.
Yeah.
For Christmas, we also come alongside the grandparents. What we do is we have a spreadsheet on the website or on Facebook.
Oh, nice. And the website is scrolling there at the bottom for everybody. So if you want to connect with Nana's Closet and donate or sign up. And so, Leela, I was just let's let families know how can they become eligible to shop at Nana's Closet?
Super easy. All they need to do is be able to prove that they have guardianship, because some families unfortunately try to scam the system.
Oh, that makes me sad for you.
And so so that way those people are not taken away from our families
Right.
that really need the help. We require that they have guardianship.
Okay.
So they have to be able to provide it, the proof of guardianship. They have to live in Oklahoma County, Cleveland County, Logan, or Canadian County.
Okay.
That's the 4 that we're working with right now, because we only have one shop.
Mm-hmm.
And so they go on our website, nanasclosetokc.org, and there's a button for application. They just go in there. What they really are going to do is tell me about themselves.
Okay.
And then they're going to tell me about the children. How old are they? What size shirts, pants, shoes do they wear?
Mm-hmm.
Because when they tell me that information, I can go through and make sure that I have at least 7 outfits for them to have. I try to make sure there's more, so that way they have the opportunity to say, well, I really don't like that.
Right. So they can fit their own style.
Yes.
Yeah.
They
That's
have
sweet.
that way they have control
Mm-hmm.
of an uncontrollable situation.
Yeah.
Because this is for
They're
them.
losing a lot.
They're losing a lot.
Yeah.
And so that's a little bit of independence for them to get to come and shop for themselves.
Yeah.
So since we only serve those 4 counties, they have to provide a utility bill.
Okay.
That's really it. I don't care how much you make. Bringing in a child is going to always hurt.
Yeah.
Especially if they come in with nothing. We do hear a lot of grandparents talk about, that thankfully we can afford it, but they donate to us.
Yeah.
But not everybody's in that situation. About 20% of our grandparents fall below poverty line.
Okay.
So they were already at the poverty line, and then they fall below it once they receive the kids.
Okay.
What DHS doesn't tell us is that once you obtain guardianship and they step out, you don't get a stipend, you don't get any financial help. And so I try to go alongside and say, when they call me, I'm like, well, if you do it this way, if DHS is involved, keep them involved.
Yeah.
I mean, yes, it's a pain, but you still get that extra stipend to help you with different things. There's nothing out there for you.
You've become kind of a consultant too, in a way. So you're able to guide these families through the whole process because you've been through it.
I've been through it. And
so experience speaks a lot.
it does. I know a lot more things than I ever planned to know.
That you do. Yeah, and you continue to learn every day, I'm sure.
Oh,
'Cause
yes.
These kids all bring different needs and different economic statuses and all of that. So,
Yes.
and you had mentioned earlier the monthly giving. So do you want to kind of talk about what is the monthly contribution that you're looking for?
Well, the main thing that I'm looking at is if we could get 300 to 500 people to donate $10 a month, that could do volumes.
Okay.
A lot of people don't realize that we donate hygiene items. We don't think about that when we donate.
Like toothpaste and body wash and things
Shampoo
like that.
and conditioner. And some people actually, since I've mentioned this, have started donating makeup because our girls are getting older and they want to wear makeup and grandma can't afford it always. And so we come alongside and provide all of that. Hairbrush. You would be surprised at how many people ask for a hairbrush or a pick or a comb.
Yeah.
And so we go to the Dollar Tree and we get a whole bunch and put it in there. We wipe out Walmart buying shampoo and conditioner, just so that way we can make sure that they have those hygiene items and they can.
That's important to maintain your health too, is you have to have that hygiene, and just it protects your body from, and your immune system too. So
yes.
That's good. Let people know how to connect with you. I know that you're signed up for Health and Hustle, so thank you so much. I'm really excited to have you out there.
We appreciate you offering it to us.
Yeah. So if people want to bring you items, can they donate to you at Health and Hustle?
Absolutely. What would be great is if they brought makeup, just like neutral colors. It doesn't have to, it doesn't have to be any specific, just neutral colors.
Okay.
If they brought shampoo and conditioner, it's hard. I know, because I have a husband, but if they could bring boys' pants.
Okay.
Because boys and men wear their clothes until they have holes and they fall off.
They don't donate them like women do. We love to just change our wardrobe every year. So yes. I can see that dilemma there.
And so boys are hard on their clothes. And so it's hard for us to get those kind of pants
in. You really need boys' clothes more than girls right now.
Boys' pants more than anything.
Boys' pants. Okay.
Sizes 7 to 16.
Okay.
Those are our biggest sizes that go through. So basically anything. Monetary donation is still really what we need. $10 a month could help us buy the hygiene items.
Okay.
$25 a month could help us go buy the pants or the shoes or anything like that we need. $50 a month, let's just say $50 a month, and 8 people donate $50 a month, and somebody needs a bed. I can go buy them a brand new bed to sleep on, and probably with a comforter and a pillow. Because a lot of these kids, when we hear from the grandparents, they're sleeping on a couch or on the floor.
Yes. Oh,
and
gosh,
so it's so important
for
them to have a bed and feel like a normal person.
Yeah, and just have that safe space to put your head down so you can sleep. And when you sleep, you heal, and you need that. You need that time.
Exactly.
And so I would love to encourage everybody to come out to Health and Hustle. It's tomorrow at Church of the Servant, and we'll be there from 10 to 2. And we'll have a big box next to Leela's table. So if you have any of these items that she needs, you just drop it in, and make sure you connect with her too. If she's got an email thing to sign up for, so you receive messages and understand kind of the needs throughout the year, because Christmas is coming. Christmas in July. I love that you're kind of getting ready for that now, because Christmas is important for children, just to make them feel loved and
so
special.
Important. And so the financial donation will help us have parties. What we usually do is we have 2 parties, one north and one south, because we serve such a wide variety. We make sure that they can drive to where we need to, because a lot of grandparents don't see after dark.
Right.
And so we try to make it early enough and close enough that they can come and enjoy the party. We have Santa there.
Okay.
The Shriners offered a Santa. So Mr. and Mrs. Claus come every year. My husband sometimes dresses up as the Grinch.
Okay.
But we are looking for a volunteer to be the Grinch at our parties. We have cookies, we have pizza, and we just love them. They come and they get their presents, and they have a good time.
Sounds like a fun day.
It is a fun day. Last year, our church, Westmore Community Church, did a skit for them, a Christmas skit at each location. So it's just growing and growing.
That's super cute. And so I know, are you still doing stuff at the Caregiver magazine too?
Yes.
Okay, good. Is there anything coming up that we should all know about?
Just right now is the campaign for the monetary donations. What I do have is where we are currently located at. They're selling the part of the church that we are in.
Oh, so do you have to move?
We have to move. They're going to move us to another area, but it's smaller than where we're at, and we are already outgrown where we are.
Okay, gotcha.
And we won't have our storage. So what we're looking for is someone that wants a tax write-off and would donate a building to us. And not to sound needy, My idea of a perfect place would be a place where my kids can feel same that they do now.
Yeah.
It's not that I'm picky at all. I just want my kids to feel like they're going to the store.
Yeah.
I had one child specific tell his grandmother, Nana, they closed the store down just for me.
Oh.
And so us making it look like a boutique
yes,
is
that's important.
is important. But that in air conditioning, because grandmas need the air.
Well, if it's hot and you're shopping, that just makes it miserable for everybody.
So what they usually do is, the kids are over here going through the toys, grandma's looking at the clothes, and then they get to go try them on. So
okay. So yeah, no, that is definitely a need out there. So if anybody listening knows of a building or somewhere that Nana's Closet could find a bigger home that's going to last for a long time, we need to find a good space.
You'll receive a great gift from just seeing their smiles.
Yeah, no, kids are amazing, and so we need to take care of the kids because when they go through that trauma, children are a product of their environment, and so we want them to grow up to be sustainable adults and not broken adults, right?
Yes.
Yeah. What is one item that always disappears as soon as it's donated?
Hygiene. That is the biggest.
It's the number one thing. Let's bring some hygiene items to that donation box at Health and Hustle, you guys. And then what is something people are surprised to learn that you do provide?
A lot of times they're surprised we help provide beds.
Okay. Yeah, that's huge.
It is.
How can businesses partner with Nana's Closet?
Well, we could use sponsors.
Mm-hmm.
We'd be happy to blast them on our Facebook page, on our website, just to help us make sure that we can sustain our children.
Nice. And do you have those sponsorships on your website that people can look at? Okay.
Mm-hmm.
So Nana's Closet,
or
OKC.org.
Nana's Closet, OKC.org. Or if they want to look at our Christmas program, it's Nana's Christmas Sharing, OKC.org.
Okay. Perfect. And she'll be out at Health and Hustle, so you can scan her QR codes right there.
Yes, I'll have everything at our table.
Perfect. So if you don't want to do it online, you want to do it in person, because some people don't like to do things online, you can just come talk to her directly tomorrow.
Would love to talk to you. Just come up and we will talk to you. And if you have any questions, we can answer all those questions.
Love that. Thank you so much for everything you're doing for kids.
I
think it's a huge thing, and the impact you're going to make for these families is just, the words are not even there, just beyond measure. So thank you.
Thank you.